What's the best thing you think is going to be about being 7 years old?
Being older than other kids.
The hardest thing, I think, is when she lost elbow movement in both arms.
It steals childhood. The mobility that we all know and love and come to remember in our own childhood.
Oh, you can close that now.
It steals that from these children.
Eles podem brincar em outro lugar, mas eu não posso. Eles podem correr atrás de pipa, eu não posso.
Foi bem comovente, porque eu não tinha ideia, né?
When I was 12, my left hip ossified, and that was like, you're not running, you're not playing sports, you're not going to the gym, you're not doing any of this stuff. And it was like, holy shit, like that's who I am.
The body's soft tissues turn into bone.
It's a catastrophic disease.
People who have FOP eventually form a second skeleton, and it locks up the joints and renders movement completely impossible.
I have to take every day as it comes and really appreciate the things I do have.
But you tell her, don't jump too much, don't run too much. She couldn't care less about that. She will do whatever she wants to do.
Be careful you don't fall.
Don't ever think you can't do something. You can, you just gotta do it differently.
FOP is all about adaptation. Every day is a new opportunity to learn new tools to make my life more independent.
Looking at an adult with FOP is like going to the World Trade Center. It's a memorial to something that happened. It's a memorial to the people that suffered and died there.
She had funny-looking toes. So they took her away, brought her back and said, it's something genetic that's made her toes like that.
Everybody in the world who has FOP, the toe is abnormal in some ways. It's malformed. So there's extra bone there, there's extra bone there, there's extra bone there, and there's some extra bone there and some extra bone there. But you're doing very, very well. This is a inflammation of a muscle, inflammation of a tendon, inflammation of a ligament, inflammation of other soft tissues in the body. The swelling goes down, a new piece of bone is left, and that bone is just like every other bone in your body. It's normal bone, it's just in the wrong place. When the swelling goes away, the pain often diminishes, and people with FOP are able to resume their life, but at a different level. They've often lost movement of a joint. They can't do things that they could do before. It's as if the body gets a signal to make too much extra bone.
And that's probably why I can't put my right arm behind my back.
That's correct.
If you see those lumps and bumps, you will try to understand. Any doctor is going to try to take out a piece of tissue to understand what's going on. And a biopsy can make the situation worse.
Então eles fizeram biópsia e foi constatado que ela tinha um tumor benigno agressivo. E aí começou todo aquele sofrimento, né?
The biopsy may confuse the doctor saying that is a kind of cancer when it's not.
E foi ao longo de 8 anos, né? Essa luta aí nossa. De hospital em hospital, de diagnóstico errado, de tratamentos que não eram necessários.
E hoje com a FOP, mesmo tendo as dificuldades, eu não sofro nem a metade do que eu sofria, do que eu sofri no passado com todos os tratamentos, com todas as medicações. Eu não sofro nem a metade hoje.
So we see heterotopic bone here and here, here. There's no new flare-ups. These are all old bone.
Isso é tudo osso velho.
One mother said to me, today is the best day my child is going to have. It's unpredictable how bad it will become and how soon it will become bad.
Of course, I'd never seen anything like this. When I looked this up, I found a paper and phoned up Dr. Kaplan in America and asked him, so I think I've got a patient with, how will I be sure? And he said to me, so just look at the toes. It became the simplest diagnosis in the world. Looking at the toes, looking at the lumps. And I've seen hundreds of patients at international meetings and so on. You make the diagnosis across the street. And we just don't know where they are.
You know, I feel very, very sorry for those parents because they don't know what it is. They're sitting with the child, look at the child suffering.
It's heartbreaking to think that if these people could just know what they have, they could prevent so much harm being done to them.
If I was one of those mothers with a child, I sure would want someone somewhere to care enough to search.
Et c'est une nécessité presque vitale en fait de se regrouper au-delà des frontières nationales, au-delà des barrières du langage, pour vraiment créer une communauté forte à travers le monde.
We want to find as many people as possible all over the world who have FOP.
We're coming with hope.
We're on the threshold of identifying a treatment that is going to be effective for FOP.
It's certainly, the most exciting time since I've been diagnosed.
Minhas esperanças foi renovada, né? Porque tem esses medicamentos em desenvolvimento. Eu tô com bastante expectativa.
My hope is that people learn from it and learn that life's gonna be okay.
There's a tremendous resilience of spirit that says, I may have one of the rarest conditions known to mankind, but I'm gonna prevail.
She is a determined little girl and she will do whatever she wants.
And I haven't tried this before. I can hear it.
Woo! Claro que a gente pergunta, por que eu, né? Mas a gente não sabe, só Deus que sabe. O Deus tem um propósito na nossa vida, então a gente tem que seguir de uma maneira que a gente se adapta e a gente acaba ensinando outras pessoas a viver também, né?